Hello, everyone, and welcome to our RESI Digital Health virtual panel. This panel is moderated by Stephen Kearney, and I will let him lead the conversation. Stephen?
Thank you very much, Karen. My name is Stephen Kearney. I'm a medical doctor, and I work with a global reinsurance company called Hanover Re, third largest reinsurance company globally. And my role is basically leading up innovation as a broad topic, both internal innovation projects and external innovation engagement, which would include engaging with startups with innovative products, including digital health products that want to engage with insurance companies, right the way through to engaging with large insurance companies, our classic clients, if they want to get insights on topics such as whether they should be reimbursing for digital health solutions, to internal strategic issues around, for example, the effect that genetics might have on insurance, the effect that high cost pharmaceutical medicines might have on insurance, that type of thing. So yeah, I'll be doing my best to try and moderate this slightly different panel discussion here with the crew. So I'll let the other participants introduce themselves now. Neha, if you want to go ahead.
Yeah, thank you, Stephen. So yeah, my name is Neha Tana. I'm also a medical doctor and now working with Joyance Partners. We're an early stage venture capital fund, predominantly focusing on US, Europe, and a little bit in Asia. I'd say 50% of our investments are in the life science space, right from biotech all the way through to therapeutics, diagnostics, health tech, femtech, genetics. And we go super early stage. We like to ideally be the first institutional investor in, and we're particularly interested in sort of areas that are pushing boundaries and driving science out to consumers as well. Thank you.
Thank you, Neha. Wieger, if you want to go ahead and introduce yourself.
Yeah, my name is Wieger Vos, and I work within KPN. KPN is the largest telco in the Netherlands and has its own corporate venture funds. My role within KPN Health is I'm responsible for participations and strategy. So both the companies that we fully own, I represent, and the investments we do. And we are investing in digital health. Besides that, we invest in cybersecurity, network technology, all things related to data analytics, cloud computing, more telco stuff. But digital health is one of our main topics. And we have a direct investment strategy as well as a fund-and-fund strategy. So earlier investments we usually do via our fund-and-fund. We have in healthcare a fund where we invest with one of the largest healthcare insurers in the Netherlands in early stage companies as well. That's it. Thank you.
Thanks, Wieger. And Christoph from Early Bird.
Yes, so my name is Christoph Messner. I'm from Early Bird Venture Capital. By training, I'm a scientist. I have a PhD in synthetic biology, and I work for the Early Bird Health Fund. We're early stage investor too. We're investing usually, we feel probably the most comfortable in Series A, but we also did out of this fund already Series seed investments, and we went up to Series C. We invest across healthcare as long as it's patient-centric. So we are very, very focused on positive patient outcomes, and we invest in starting from biopharma to the digital health, R&D tools, diagnostics too, and medical devices. Thank you.
Great, thanks, Christoph. I guess, given the unusual circumstances of this RESI conference, the fact that we're having it and hosting it virtually as opposed to in person, and that the fact that a lot of conferences for the foreseeable future, at least in Europe, have been cancelled. I guess a question on the mind of people listening to this, I imagine that a large majority of the audio audience will be people looking for investment, and I guess traditionally they would have engaged with you guys, whether through intermediaries, warm introductions, that classical route, but obviously also conferences would have been a means to engage with you guys. Has your firms discussed internally, or have you guys spoken with colleagues about how you intend to maintain deal flow over the coming months? Are you hunkering down and just concentrating on your current portfolio, and would you recommend for prospective startups to basically press the pause button? Are you guys too busy with things at the moment? Yeah, so basically, how are you managing the current COVID situation? How is it managing your deal flow? How is it affecting even the management of your interactions with current portfolio companies? And what advice would you give to the audience with regards to engaging with yourself over the coming months? Neha, do you want to start off on that?
Yeah, sure. Yes, you're right. It is a slightly strange conversation, but we discussed it at great length internally a few days ago. All of our sort of travels have been cut short, and of course there will be a reduction in terms of potential face-to-face introductions. But for us, because we work across multiple geographies, a lot of them come through, I guess, people we know. And we're still open to having warm introductions. We're still open to investments. I think what will change is how we due diligence them and look at what are their contingency plans for perhaps the next 18 to 24 months, and are they aware of, have they thought about the potential future challenges they might face that may well have a knock-on effect on valuations, perhaps, when it comes to term sheets and negotiations. If it gets that far in this really difficult phase, it may be that valuations come right the way down. We were looking at a report earlier this morning, comparing it to previous crises, and I believe it says that this crisis is closer to the 1930 crisis, not even the 2008 crisis, where things were falling by 50%. So I think that's going to have an impact on lots and lots of people. As an individual fund, we actually have in-house deal sourcing tools that sort of scrape the web and look for social signaling. So we pick up quite a lot of companies that way. I think what's going to be interesting for us is to see whether there is a downturn in the number of companies that pop up. I imagine there will be, but we are still open to having chats and conversations. And of course, aside to that, we're doubling down on helping our portfolio companies too. Yeah, does that answer the question a little bit?
I think very much so. Yeah, it's putting some flesh on the bones there with regards to, I guess, people's curiosity as to what your own contingency plans are. It's interesting that you'll be still prospecting the market, searching for tools. The effects on valuations, as you said, may be profound. Obviously, startups approaching you guys will want to have modified their pitch decks, perhaps to have an extra slide to say how are they going to deal with the COVID issue over the next 12 to 24 months. All very good points. Viger, would you have anything to add to that?
Yeah, I'd say for us, we also have a geographical spread thing going from Israel to Northwest America. So a lot of our intros are done via email or warm introductions, and most follow-ups are done via video conference anyway. So to us, I think the way of working doesn't change that much. I think what we see happening in the Netherlands is that the digitalization of healthcare is immediately becoming more and more important. So part of our portfolio is focusing on digitalization of very simple processes like a video conference for a video consult for a doctor, or a simple triage or booking systems, and those we see a huge uptake now. And the same goes for parts of care where that are very labor intensive. For instance, night care, which is done most of the time nowadays in the Netherlands by people, and that goes into, for instance, night surveillance by smart sensoring, and so you see a lot of questions be raised. So I'd say this kind of crises, I think, are also from a market perspective important to see what kind of questions are raised in this kind of times, and would give also, I think, very valuable insights to investors on what to invest in if it comes to digital health.
So one thing there that I'm taking out of this is that maybe this is good for business, essentially. I think that's, at least for your strategic investment focus area, and obviously digitalization of healthcare and telehealth. One statistic that popped up on my screen in the last few weeks is I think it's a good doctor in China had a 10x increase in business in the months of January and February, and obviously the US companies like Teladoc, etc. People are keeping an eye on their performance at the moment. So it sounds like, if I'm not mistaken, that opportunities are, if anything, there's a strong silver lining to the current situation. Is what you're saying, Viger? Your previous processes around engaging with startups were digital via video conferencing. So it's basically business as usual, full steam ahead, is the takeaway message.
Yeah, and the way we are used to work, so via video in a digital way, we are largely a digital company. I see the adoption of those kind of services in healthcare as well.
Great. And Christoph, at Early Bird, you guys obviously working not only in digital health, but I believe across a broader portfolio. How has the current situation impacted on you guys, and what are your processes going forward?
So I think for us, it's probably the same as for Neha and Weiger. It's a bit, I think now it's probably a bit bumpy. Everybody now at first takes care of their own portfolio, right? We're having a lot of chat with our portfolio company, talking about the contingency plans and so on and so forth. But in the end, is also what the other two colleagues said. In the end, we are very used to work digitally. We are very used to get to have strong deal flow from our network, strong deal flow via our portal, deal flow through to conferences like the RESI. And I think in the end we will travel less, and therefore we'll have actually quite a lot of time to look thoroughly, to pitch decks, to have introductory meetings we're using Zoom actually every day. So this is our first tool how we actually start engaging with companies, so that we don't have to travel Europe every week twice, right? So I think we're used to it, and I think for companies or for startups, it's actually a good opportunity. They might need to take a cut in valuation, but I mean, I think this is a relatively generic view, because, for instance, I think diagnostic companies have a great chance actually these days to really make a huge impact. And as we saw in the last couple of years, it was very difficult for diagnostic companies to actually close their financing round and get proper financing. And I think this will change now dramatically in this period of time. And maybe if I can add, if I talk about diagnostic companies, maybe I can add, especially decentralized diagnostic. I think this will be a big part. I think we believe that healthcare is moving there anyway, right? That in general healthcare will be decentralized. And if you think about now that in the corona crisis, right, we need still a couple of hours, if not days, to get positive tests back, right? And if we would have a quick and decentralized testing for these kind of diseases, I think these are great opportunities for startups here.
Yeah, Wieger here. I see the same. I think for all things related to digital engaged patients. So, for instance, Apple's launched here recently, or actually 2-3 days ago, for a kind of self triage for corona, which had a huge uptake here. So I think providing patients more means to do things themselves. And that can be simple things like booking, but more complicated things like self-diagnosis or self-triage, or the things that Babylon Health, for instance, is working on. I think what we see, and especially in places where we have lockdown, that is going to be very important. And also, I think a very important way to keep a sustainable business model for healthcare on the long term in these kind of crisis situations.
Very interesting points, and good points, Christoph, around the potential opportunities in the diagnostic space. Traditionally a challenging area for developing revenue and reimbursement models, but obviously there's plenty of opportunity there. Christoph, would you have any opinions when it comes to, and would you personally or your firm have a focus on B2C versus B2B diagnostics? We've seen some innovations in the DTC diagnostic space. For example, an Irish company, Let's Get Checked, has undergone a couple of relatively sizable funding rounds. Optum Ventures, the venture capital arm of the largest US healthcare insurance company, United Health, has been their lead investor for a while. And their model is DTC, somewhat controversial, but they seem to be doing very well. I could imagine that there's a large market out there for DTC COVID testing. Has any such opportunities appeared on anyone's radar? Yeah, so I guess the question is B2B versus B2C in the diagnostic space. Any opinions on that?
So maybe I'll start with a little bit more generic answer, and I think that we are very strong believers in B2B approaches, right? We're very strong believers in reimbursement. We think this is in where the money is in healthcare, to be very honest, right? And especially in healthcare, I think you need to follow the money, and you need to follow these kind of streams, and you need to especially take care that you're aligning all the stakeholders in the system. Otherwise, you're fighting a very, very steep uphill battle. And the market usually seems to be relatively big in B2C. But maybe Wieger or Neha, maybe you're going to tell me the difference, but I think we see very rarely B2C business really succeeding, because for instance in Germany, right, and I think I haven't mentioned it now, but the second largest German health insurance is a cornerstone investor in our fund. It's the Barmen. They have 10 million insurees, right, and I think it is very clear that in a system like Germany and I think in all the other European systems, people actually see healthcare as a service from the state, right, or as a service from healthcare insurers, and we're not really used to pay anything on top of what we pay anyway, right? And I think it's a very difficult business case to make, and especially to have then adoption and widespread market uptake really in a B2C market. So also for diagnostics, I think if it's not a very special case like we have now, I think diagnostics should be reimbursed, and this is also where the biggest uptake will come from, right? We have usually the doctors as the gatekeepers, and I'm not sure whether, as I said, widespread market adoption will be seen in B2C cases. Maybe in some very specific cases, like if you think about sexually transmitted diseases, for instance, right? If you don't really want to go to the doctor and you have some other issues, maybe there's some money that can be made. But I think that the largest part will be B2B and reimbursement market.
Yeah, can I just add to that? I agree with Christoph in terms of B2B for healthcare and the reimbursement market. It's predominantly the main model in Europe, I presume. Well, I can speak for the UK. But when you start sort of where it gets a bit grey for me and for what we've seen is it depends on what condition you're diagnosing, what condition you're treating, and what you're looking for. So there are, there's the thrivers who, point of care, blood test at home. I've just come back from Asia a couple of weeks ago where it is predominantly a consumer driven market and reimbursement just doesn't really apply hugely there. And so I do believe that there is a space for direct to consumer, but I think you have to be careful on two fronts: the market you're in, and then to the kind of condition that you're diagnosing. So for example, the situation that we're in right now, it has to be sort of a B2B model, or for conditions like cancer, certain chronic conditions, diabetes, you can't allow, or I don't believe there would be great adoption for self-diagnosis. It's treading on dangerous waters. But if you're coming into this wellness space where you have sports personalities and athletes who are really interested in their own bodies and wanting to understand how their body responds to sort of certain foods with glucose spikes, that's where the gray area comes in for us around self-diagnoses. We have a company that have come up with an intradermal patch, and through interstitial fluid, it's measuring glucose, lactate, electrolytes. And whilst sort of the ethos or the intention of the founders is to help patients with diabetes in the long run, actually where they're getting huge amounts of traction and adoption is through sports personalities, athletes, runners, people are really into their fitness. They were generating a significant amount of cash flow and then will use that to cross over into the medical field. So it's sort of these innovative business models that perhaps can counter some of these traditional models. Yeah, that's really another angle to it.
Very interesting points, Nia. Yeah, so basically applying a twin track approach is perhaps what you're saying, that there's obviously specific consumer niches that you can go after, and certain geography is geographic specific, which is what we would see from a global sort of insurance perspective, that a lot of the interesting startups that we are tracking maybe have their origins in Asia, because they were able to get consumer traction there in the first instance. Maybe it's not going to provide their revenues, their big revenues in the long term, but they were able to enter a consumer-led reimbursement space in Asia in the first instance.
Yeah, it's kind of lower. In some areas it's lower barrier to entry, right? Where initially the capital might be quite hard to get. That's what I've seen. And
perhaps lower regulatory barriers to entry, perhaps in Asia as well. Or greater sort of acceptance around certain products from a patient and doctor perspective. Vigor, would you have anything to add to that B2B versus B2C debate?
Yeah, we are for large part a B2C company, so we service the majority, I think, of Dutch households with services. And we tried via one of our startups, which provides a smart sensoring solution for elderly people to sell this via informal care providers, so relatives, family members, especially for elderly. And it was a very, very difficult sell to make, and also to find a price point that is acceptable for patients or consumers to pay for. If you relate this kind of price points that we usually tap into in a reimbursed model, and also price points in all fairness that we need to ask, because to cover the cost for this kind of service is quite expensive. It's very difficult to sell this kind of services. So our approach is always mainly in a B2B2C approach. So for instance, we sell it to individuals, but over or reimbursed by insurers. The only thing I probably foresee happening is, if you look at a large part of the Western states, and I think for Europe as well. So I think the total spend for healthcare in the Netherlands now exceeds 100 billion euros, and it's increasing rapidly year over year. So I think there's going to be a point that governments probably will say there is a certain level or certain captation on the spend of healthcare, which will offer opportunities for B2C providers to provide the part of care that isn't provided by or isn't reimbursed via social systems, like Christoph mentioned. But if that doesn't happen, and we still keep paying this from public funds, it's going to be a very, very hard market for B2C, I think.
I think one of the, so just to tap into this, I think it's actually quite interesting that you say that, because what we see here is that, especially health insurances, obviously, they look very much into health economics, right? So that the health economics has to work out, because they face exactly this kind of problem, right? And what we see is that everything, for instance, everything that we finance has to have also somehow a positive angle on health economics, because you will run exactly into this problem, right? And I'm not sure. I mean, and I'm really not sure, right? So this is not just a saying. So I'm really not sure whether this will open more the markets more towards B2C, or that will have to be very, very careful on a health economic standpoint.
The impression I'm getting from all your feedback on this recent discussion around B2C versus B2B, and Christoph, your mention of health economics, you guys have a lot of personal and obviously firm, your VC firm have a lot of internal knowledge when it comes to basically playbooks and reimbursement playbooks. That's the impression I am getting. So it leads me on to the question: how much do you guys, the spectrum there of letting your investees, your portfolio companies, just get on with things once you make an investment? Do you sort of trust their reimbursement hypothesis and model? Or do you have very sort of structured reimbursement playbooks that you encourage them to go down, be that enter certain markets, engage with certain insurance companies, do healthcare economic assessments on what they're providing? Yeah, so I guess the question is, the traditional question, are you guys, do you get very involved in the operations of your investees, and does that have a role to play, especially around on the reimbursement side of things? Christoph?
So
Hello?
I think for us,
Okay.
yes, I'm still here.
Okay.
For us, I think reimbursement, a plan to reimbursement is for us a very is a part of the due diligence, to be very honest, because I think that the companies that we're investing in, you know, if they're already Series A or maybe even later, they have to have a very clear roadmap towards development and towards reimbursement. And this is usually actually these are clinical trials, right? So you need to show efficacy, you need to show you know, and then afterwards maybe also health economic benefits and so on and so forth. So we help where we can, and as I said before, so we have very strong ties, especially in the German healthcare system, also to get input, you know, to talk to the health insurances beforehand, what kind of data they actually expect to see for a product to be then in the end reimbursable. But what we actually want is to have reimbursement across health insurers in across in countries, right? So we don't really like too much selective contracts, to be honest. And then you asked about whether we then trust them with their operations, and I think yes, of course we do. We're not running the company, right? So we're helping everywhere where we can. We have, you know, relatively high standards, I think, especially if it comes to reimbursement. But then afterwards, I think if we invest in a team, and you know, this is our yeah, from this point on, we trust them and we help everywhere we can.
Great. And Neha, would you second that, or?
Yeah, absolutely. I think the founders' understanding of go-to-market, reimbursement, health economics is really crucial to us deciding whether we believe, you know, the founder has it in them to be a success. We're really early stage, so the belief and the trust in them is absolutely paramount for us. Of course, we can help them where we try, but as our fund, we actually don't take board seats, so there's an even extra element of trust and believing that they can deliver on what they say. So yeah, absolutely second Christoph.
Interesting. Yeah, so definitely a more of a hands-off approach and a trusting approach, and once, I guess, due diligence is complete. Rieger,
sorry, maybe I'll just add, because I forgot, and I think this is important, especially for the startups who are listening. So we take board seats, and we are actually quite hands-on investors. So we trust you, but we also help you, you know, in your day-to-day business. Sorry, Rieger, I don't want to interrupt you.
Never mind. I just lost connection, so lost part of the discussion. But I think we also tend to have a board seat, and I think what's important, because we are a strategic investor and we have a large presence in the Dutch market, good relationships with a lot of customers, but also with all kind of public institutions, reimbursement payers. We know a lot of people. So we tend to help our portfolio companies as well. Having said so, we preferable invest in companies, or we only invest in companies that already have a clear business model. So it's not something, the reimbursement model is not something that if we have to change something about the reimbursement model, it's probably too late, and we wouldn't invest in something. So there has to be a clear view on reimbursement.
Okay. Interesting feedback about your views on reimbursement and your roles when it comes to degree of involvement. Another thing that's striking me here is the geographic location of your firm seems to be important for your portfolio, or at least add some value for your potential portfolio companies. Neha in London, Christoph in Germany, or if I'm not mistaken, and Rieger in the Netherlands. So I guess my next question is, I guess a lot of the audience won't be geographically based in those locations. So what is your firm's views around, let's say, an investment proposal coming to you from Southeastern Europe, Greece, the Balkans, I guess the Nordics are quite close to you, but or even something as distant. We've been looking at opportunities, for example, in South Africa, a very sort of European-style market, a lot of innovation going on there in the insurance space, a very dynamic health and life insurance market, in the same time zone as ourselves, but not somewhere where you would at least classically think of as a prime spot. And Africa, we see a lot of booming investments in the digital health space, you know, given their resource constraints there. So I guess the question is geography. Are there constraints on that? What your opinions are? Any interesting investments? What's your furthest away investment? Christoph?
So we are a Europe-centric fund. So we're not really German-centric, to be honest, even though we have strong ties here. Out of our 11 portfolio companies, we only have 2 German companies. So we look into healthcare companies across Europe. We are also allowed to invest in Israeli companies, and we'll probably have a US investment very soon too. So we also look into this, but so if we invest in companies out of Europe, they usually have to have strong ties to Europe, or they want to build up operations in Europe and these kind of things, because this is, you know, these are the markets that we know, where we feel comfortable with, and where we can also help our startups with our network, with our knowledge, and this is why we're focusing on Europe.
Igor, would you be the same? Would you be Eurocentric?
We are Eurocentric. We don't have any geographical restrictions. So we invest basically all over the globe, but we see our investments so far have been in Europe and partially in Israel, especially on cybersecurity, which is very well developed in Israel as well. Having said so, I think for us it's really important that you are looking for an opportunity in the European market, and our strategic fit is the strongest if you are looking for opportunities in the Dutch market or the DACH countries. So Deutschland, Australia, Switzerland. So if you're looking for those kind of areas, that's interesting. Another thing that is really interesting, a really interesting market for us is Finland. So we see a lot of Finnish companies that seem to have a very strong fit with our home market. So that's basically how we look at it. So, but everyone is welcome from all over the globe, but you have to have some focus on or have an investments or an implementation strategy or an urge to go to the Dutch market.
So it needs. So just to be fully clear on that, potential startups looking at interacting with yourselves should have a Dutch element to their plans, not just a DACH area, but a Dutch element.
Yeah, preferable, since then we have the strongest strategic fit, and you can benefit from our strategic position in the Dutch market. Otherwise, it's going to be harder.
Makes sense. Neha?
Yeah, so a little bit different. We are not restricted by geography at all. Our investments have predominantly been in the US and Europe, but we also have investments in Japan, Korea, and India. We've actually we've seen a lot in the Nordics. We have venture partners across Europe. But I think our most recent surprise investment was a company in Poland selling into India. I guess the reason we went for it, we like the science, we like the founder, and I'd say as a firm and as a team, we kind of try and go where we see good science. So yeah, not bound by geography, and we welcome startups from anywhere really at this stage.
Okay. So I think that's useful information to anyone listening, who to approach if they have investment proposals. And And I guess that leads me on the fact that that's fascinating what you say about the Polish company selling into India, and part of that was science related. And you said before that you're interested in, if I'm not mistaken, certain strategic niches within digital health. You mentioned femtech, also, correct me if I'm wrong, but perhaps deep tech, translating science into commercial products. So I guess the question is, what's hot and what's not, from microbiome to genomics to, I printed off CB Insights Digital Health 150 poster. Obviously, we're all a little bit jaded by AI, but it seems to be finally having an impact. The antibiotics paper that came out of MIT a few weeks ago, discovered via AI. Are you guys still looking at, is AI something that creates red flags for you guys on pitch decks, or is it something that you're happy to see if the science backs it up? Yeah, so I guess the question is verticals within digital health. We've also seen genomics, for example, take a little bit of a flat line, if not a bit of a nosedive. 23andMe and Ancestry.com laying off people. Obviously, there's a handful of startups in the direct-to-consumer genomic space, also in the B2B genomic space. We've seen a number of companies either go bust in that area. So yeah, I guess the question is, what's hot, what's not within various various sub niches, or where are you laying your bets within digital health these days? Nia, do you want to start off on that?
Yeah, sure. So it's a really good question. I think for us, we're not jaded by AI, but I think what we're looking at now are for companies that have really good algorithms that can actually generate good actionable insights from these algorithms. You know, it's one thing to have pattern recognition, it's one thing to sort of have really simple algorithms that just generate reports, but it's more about what can you do with all of that data and what can those algorithms achieve. But in terms of hot topics, I guess for us, all of the above that you mentioned are interesting. Prevention, prediction are definitely areas that we look at. In the life sciences space, anything that I guess, maybe this is a little bit generic, but novel or innovative in the therapeutic space. Diagnostics is really interesting for us, more from a D2C perspective or B2B2C perspective. And for us, deep tech is really important. So for us, it's the science, and if it's validated science that's probably protectable, then I think we will look at it. Yeah.
Vigor, do you have anything to add to that? Do you guys have a particular, I guess, coming from a strategic investment fund with a telecoms background, are you guys focused, for example, are you seeing any overlap? You've mentioned cybersecurity as an area that you guys are investing in, traditional cybersecurity. Have you seen any, is cybersecurity as it applies to medicine and digital health an area that you guys are exploring, or is there other niches within digital health that you guys are particularly fascinated with?
Yeah, I think in the field of cybersecurity, it's far more advanced what we see happening there on AI. I think and I'm quoting someone else here, that AI in healthcare is like teenage sex. Everyone talks about it, nobody knows how to do it, and everyone thinks everyone else is doing it, so claims to do it. So we see a lot of fuss around AI. The companies we see in the Netherlands that are successful in AI are most of the time project oriented. So they do certain specific projects for university medical centers, for instance, that want to do something with AI or claim that they're doing it, and they're looking for companies to help them. But even if you look at I think solutions like advanced triaging by AI assistance, most of the time it's a rule-based kind of way of working. So it's basically a decision tree and not so much of AI happening there. But that's what I see happening here. But I'm very curious about Christoph's opinion on that. I think Christoph probably see more of this early stage companies probably.
We do see a lot. We do see a lot, and I think you know, in AI, we see AI very basically as a tool, right? At best, it's a technology. Usually, it's, you know, it's part of a technology, and the question is, what we are always having is actually what is the product actually? You know, is the product somehow, you know, are patient helped by this product? Are, you know, patients somehow, are they getting, you know, are they getting better, quicker, or cheaper, or, you know, how can we treat these patients with this kind of products, right? And so I think what happens a lot is that founders put AI in the center of their pitch deck and of their company, and we, at least my opinion, I'm not even sure what this is Early Bird Health's opinion, but my opinion is that's a mistake. I think it's about a product, it's about how you help the people. And what is very interesting actually, and I don't know whether you guys know about this, but there is in Germany now a law is passed which is called the Digital Care Act. In English, in German is so what actually this law says, and this is very, you know, in a nutshell, and probably if somebody from the Barmer hears me now, they would basically kill me. But this law actually permits doctors to prescribe digital apps, right? So and which offers obviously a large potentials for healthcare companies or digital health companies here in Germany, that and these apps or these health apps are then paid by health insurance. But what is very important here, and this is, I think, something that where, you know, this is where our investment hypothesis starts. So that even though that these health or these digital health apps, they don't have to show already clinical results or positive clinical studies, they have to have initial positive results, right? And they need to show initial efficacy, and then they have about a year time in the market, reimbursed, prescribed by the doctor. They have this amount of time, so by basically a year, to then show efficacy and then be kept in the reimbursement system. So I think this is something which is quite unique in Germany, and we are very excited actually about this, that you know, that this happens here now. It underlines really the clinical validation, even though it's digital health. You know, just because it's digital, you still need to do clinical studies.
Thanks, Christoph. I don't know if anyone noticed, I accidentally dropped off the call there for a minute or two, but I got most of what you said. I guess my next question is, that's interesting around the sort of macro focus, particular areas that you guys are interested in, zooming in on more micro, more actual tangible examples. I'd be fascinated for each of you to give an example of basically maybe your favorite both internal portfolio company, a pet, whether you are involved with them personally or they happen to be on your portfolio. So one startup that you're particularly excited by that you guys have invested in, and then an example of a startup that you guys haven't invested in for whatever reason, whether it's geographic or it just they're not in the right funding position for you guys. Maybe they're more later stage, for example. But another example of a startup that particularly excites you personally in the digital health space. Neha, would you like to start off on that?
Yeah, sure. Now you're testing my memory. We have over 400 companies, but I think one of my favorites was one that I mentioned earlier, Cora, who are the intradermal patch that are recording various components of the interstitial fluid. I think that has the potential for significant impact on what we're now calling lifestyle diseases and chronic conditions. You know, diabetes and measuring glucose is something that is on the rise, but also has been traditionally the same for a while. I know there's sort of continuous glucose monitoring things that are coming out, but in terms of adoption, right from pre-diabetics up to insulin-dependent diabetics, I think that has significant potential. And I just think they're being really creative about barriers to entry in the market. I think they're being super cautious. They're sort of navigating this difficult time also really well, both from a cost perspective and product development perspective. So I'd say within our portfolio, they were definitely one of our favorites. And we have a similar one in the US called Epicor. So they're not really competitors, but these guys are looking at sort of sweat and measuring parameters through that. And then perhaps one that we missed or is a bit late for us, and more because I like the team, but Ada Health, I think, are an incredible company. I think they've been really diligent about their product development. They've pivoted from certain areas because they realized that it's the limitations, for example, telemedicine and switching to an AI chatbot. But what they're doing with their data set and interpreting symptoms and signs from consumers and connecting them into healthcare professionals, I think is really, really interesting. But they're very late stage for us. But if given the chance, I would have invested in them at the beginning.
You'll have to forgive me, Neha, maybe it's the line quality, but I didn't quite catch the name of that company that you guys didn't invest in, that you spoke about.
Ada Health, Ada Health.
Oh, Ada Health, yes, okay,
Yeah,
perfect.
you know them. Yeah.
Interesting. And Viger, do you want to take the same question? Any internal pets and any external companies
I think,
that you have a particular eye on?
Yeah, so one company we invested via our fountain fund is a company called MedApp. They had over 200,000 downloads in a very short period. They provide basically a way for chronic patients to take care of their medication. And the interesting part is we discussed the business model earlier. This company didn't have a reimbursement model in place, but had a very strong proposition to end users, strong downloads, extremely good reviews. Even people voluntarily paid them money. So they actually mailed the company and said, well, we're so happy with your app and we feel obliged to pay you something. So what can we pay? So they had donations from their customers, pretty special. And they recently turned into providing also delivery of medication and stepped into the traditional reimbursement model for local pharmacies, together with one of the largest online pharmacies in the Netherlands. And they, because they have a very strong brand name, are very successful in that. So that's a very strong, I think, example of putting your customer first, as Christoph also mentioned, provide them with a solution and find a strong business model.
Viger, you're going to have to forgive me. You're going to have to forgive me again there. Maybe it's line quality, maybe it's my hearing. Can you just repeat or spell the name of that company?
It's a MedApp, so MEDAPP, MedApp, and it's a Dutch company, and we invested in them via fund of funds, quite early stage, but a very interesting company to follow. And there are some that I would like to have invested earlier. So, for instance, we work together with Zivver, which is a secure email application that is very successful in the healthcare sector. And the thing was that at that moment in time, and that is, I think, as a corporate fund, we had a competing solution of our own company. So we said we didn't invest in them because we didn't want to invest in one of our competitors. And yeah, basically they were very successful in their market, and recently we stopped our product in the market and joined them as a distributor. But their last round was, I think, a Series B, which was too large for us. So I would have liked to invest in them earlier. So that is one investment I would like would have made if I could make the same decision today.
And you're going to have to forgive me again.
It's Zivver. Yeah, it's
Zivver. Z-I-P-H-E-R.
Z-I-V-V-E-R. Zivver.
Z-I-T-T-E-R. T for Tango.
V from Victor.
Oh, Zipper. Okay.
Yeah, Zivver.
Very good. And Christoph, yourself, internal and external tax.
So internal, I think what we have a very interesting company, especially now in the times of diagnosis, is companies called Wallaby. They're working in the corporate health management. Now probably everybody will think, oh God, this is a bit boring. Turns out that excuse me, they found a way to have very high engagement, and what they're actually selling is health checkups, right? So they're checking you in 15 minutes. You have a full body checkup, which we get some blood values, you get your pulse, or everything, your cardiovascular system tested, and so on and so forth. And straight afterwards, you get a teleconsultation with your doctor, and you get all your biomarkers uploaded in your app, and you have them with you, right? And I think what is very interesting here is that they are diagnosing a lot of chronic or people with chronic diseases. They already in the last 1.5 years saved and they really saved 97 lives. Which I think it's quite interesting. And what happens there with Wallaby is that because they have this longitudinal data, because they go into these corporates, year by year, right? They have a very nice data set, and they will start doing predictions on which kind of preventative measures then makes actually your employees more healthy. And what they do for them actually having the right measures on the platform is they're using measures from other digital health companies, for instance, from Oviva, which is also a portfolio company from us, and they're working in the pre-diabetes prevention space. And so then what Wallaby does is if they diagnose somebody with pre-diabetes, they suggest them to do the Oviva offering. And the Oviva offering by itself is also clinically proven, and therefore they then really can show a positive ROI for the employee and for the employer then in the end. I think this is really interesting as it's the people are getting really engaged in their own health, and it's purely based also on science and it has very strong diagnostic accuracy. And so this is a portfolio company of ours. And the company that we unfortunately missed, it was Casper Health. And Casper like the ghost, right? And they're working in the rehabilitation space. And what they did actually, so there is a very huge gap in rehabilitation. So if you do, sorry, I'm hearing an echo, quite a strong one actually the whole time. Maybe better now?
Say that last bit again.
No, sorry, that I'm hearing a very strong echo of my voice.
Oh.
Yeah. No, so Casper Health, they're working in the rehabilitation space, and what they're actually doing is that there is a very big gap in the uptake of rehabilitation. So there is a very strong uptake in rehabilitation if you're in a rehabilitation clinic. But then in the moment that people leave the rehabilitation clinic, basically, I mean, now I think we did due diligence a couple of years ago, so I forgot the exact numbers, but I would guess something like 80% of the people stop doing rehabilitation, and it's known that then all the effects and all the hard work and all the hours that you put into that in the clinic is basically vanishes after a week. And what they build is they actually really build a digital rehabilitation clinic. They do the onboarding inside the physical clinic, then they have the patient in their digital rehabilitation clinic, and they get the same reimbursement as people would go and physically visit a doctor. And this is paid by pension funds actually, because they have huge interest, of course, to get people back and to work soon as possible and that the rehabilitation works. So I think this is a very, very interesting concept. Very good team also. We unfortunately missed the deal because we were just, yeah, the deal simply just arrived too late to us, and then we were, you know, there was already term sheets on the table, and yeah, so there was unfortunately not enough space anymore for us in this deal, but this would have been a good one, I think.
Great, all very interesting companies, and I can definitely detect everyone's passion from their tone of voice when they're talking about these particular companies. I guess we're coming up to the 1 hour mark. I think this is, at least for me, this has been my first virtual panel discussion. I guess my final question, or how to leave things off as we come up to the 1 hour mark, would be, I would like to ask each of you, traditionally, I guess, people, attendees at RESI would have had the opportunity to approach you personally after the panel discussion. I know that RESI has an online matchmaking forum whereby people can interact with each other digitally over the next coming days with the RESI virtual RESI platform. But other than that platform, if people haven't made appointments to speak to you guys on that, what would be the recommended route to engage with you guys? Do you encourage just sort of cold perspective, or not so much encourage, but does your website allow for pitch decks to be uploaded to you guys, or would your recommendation be find a portfolio company founder and try and get a warm intro? How should people listening to this that maybe want to engage with you guys, how should they take that conversation or that engagement forward? Neha?
Yeah, sure. So happy to have people approach us. I guess if they've heard us here, then even just a cold message on LinkedIn, or through the RESI partnering platform, to say I heard the panel and I'd like to chat about X, Y, and Z. I'm happy to be approached that way. Our website does not have a way to upload a deck. We prefer sort of direct contact.
Great. Vigor?
Yeah, I think same goes for us. It's always possible to find me on LinkedIn, or send me an email, which is my name with a single dot between my first and last name @kpn.com, or via our website. It is preferable to have a quick view on what our investment criteria are, and send a simple, short teaser or pitch deck or simple deck for us to make it easy to do a quick assessment if it's a fit. And yeah, that's basically it.
Christoph, would you be the same as that? I think early bird.
Yeah, I mean, the same. Yeah, we actually, yes, we do encourage sending us decks via our web portal. We have strong deal flow there, and what is somehow, you know, our early bird promise is that every pitch deck which is sent through is reviewed by 3 people from the team. And if we 3 agree to, you know, then to on the next steps, and so this might be that it takes a little while till we get back to you, but everything you send us is really reviewed by 3 people, and these are always 2 partners in the fund, and then it's either going to be me or my colleague who's also looking at these decks. So we were very happy to look at these decks. Also to the RESI platform, I think I replied up until now to everybody, and yeah, best thing is always, of course, send us the pitch decks, and then we'll have a look at it and see how, and then yeah, we'll just take it from there.
Great. Okay. Sounds like the world is continuing on. Potential startups that want to engage with you guys. It sounds like there's plenty of routes to do so, and it's going to be interesting times as we go forward, obviously. I'd like to thank all 3 of you for your time. I'd like to especially thank RESI for making RESI still possible in a virtual sense. So I'd like to thank them for all the background work that's gone on there with Karen in the background for organizing this virtual panel. So thank you very much, RESI, and thank you everyone that's still listening to this panel. And I wish you all the best, both personally with regards to your personal health over the next few months, and with regards to engaging with RESI over the next couple of days. Thank you, Nia. Thank you, Viger. Thank you, Christoph.
Thank you.
Thanks.
Thank you, everyone, for a wonderful panel.